Good afternoon, everyone. My name is Dr. Mayher Barmi, and I am a junior resident of MD Psychiatry in Subharti Hospital. And today I will be presenting my seminar on the topic virtual reality in psychiatry. We will be covering the following headings today. These include introduction, what is virtual reality, how virtual reality works, advances in biofeedback and data, defining virtual reality in psychiatry, why should we use virtual reality in psychiatry, virtual reality providers in India, virtual reality applications in psychiatric diseases, advantages, challenges and limitations, risk and side effects, the future directions, conclusions, and references. So first up, starting with the introduction, virtual reality is transforming psychiatric care, bringing immersive technology into diagnosis, therapy, and rehabilitation. What is virtual reality? It is a computer-generated 3D stimulation with which the users interact, experiencing a sense of presence. How does virtual reality work? So virtual reality is an immersive technique, which means that it's immersive virtual reality, which has the power to transform place and even self-representation. The concepts are immersion, place illusion, and possibility illusion. So what do we need for this now? We need a headset, which is a head-mounted display, HMD, a software that would create real feeling experiences, a set of displays. Now, these displays can be four-sided or six-sided. The visual with sensory motor contingencies, auditory and haptic. Now, these are the major senses that are involved. So visual, which means that you can see what is happening through the headset. Sensory motor contingencies mean that you can, when you move your head or you change the angle of the head, the angle of the object also changes. And this is a very important concept because in reality also, when a person changes their head angle, the object also changes. Auditory, this is via earphones, or there are speakers that can be attached in the room for voices that come from far away, and haptic means touch. A multi-sensory feedback tracking system. This is discussed in the next slide. So if you are there, then it is place illusion. And what appears to be happening is really happening is possibility illusion. You are likely to respond to it as if it were real. And we call this repair, response as if real. Advances in biofeedback and data. Real-time tracking of head movement, body movement, skin conduction, heart rate variability. All of these parameters allow objective progress measurement analyzed using artificial intelligence algorithms to provide objective data on the behavior and symptoms of the patient during specific virtual reality states, and then adaptation of therapy for the same. So this is where the advancement or the magic comes in, where you can track the vitals of the patient, the biofeedback, and cater therapy to them, which would not be possible in a reality setting. Now, virtual reality in psychiatry means using such an immersive simulation for assessment, exposure, skill building, and behavior intervention. Why should we use this? One, it could be individualized or it could be repeatable, which means the same thing can be catered to different individuals, or you can tweak it and individualize it for specific individuals. And controlled therapeutic spaces increase patient engagement and allow safe stimulation of the real world triggers. You can slowly enhance the level or the amount of simulation that you give to the patient. That would not be possible in the real world. Now, coming to what is happening in virtual reality in India, from the early agoraphobia trials 1995 to the current day modern virtual reality CBT applications and clinical validations have grown rapidly. Uh, Few of the major virtual reality based psychiatric therapy providers and applications in India include the Satya Clinic in Kolkata, Udyan Mental Health Care, National Institute of Physical Medicine and Rehabilitation, Kerala, Cogni Hub in Jaipur, Manasvi Specialists in Bangalore. Now, we see that these are the places in India that are catering to virtual reality based applications. Several virtual reality applications and therapy platforms are now available for use in psychiatric illness management in India. They primarily offered through specialized clinics, startup, and selective therapeutic app providers. Mostly the VR solutions are commonly used for anxiety disorders, phobias, PTSD, addiction, social skill training, depression, and cognitive rehabilitation. Most widely available virtual reality applications and equipments for psychiatric illness in India are enlisted in this table below. We see that the product or the provider include uh, Word, WordSight Health in Bangalore, CogniHab Jaipur, Sparsh Mind Innovations, Rehab Matrix, SciTech VR Global in India. So we see what do we need now? Now we need to have two things. One is the software, which is the product and the provider, and second is the headset. We're going to discuss more about the headset in the next slide, but specific softwares require specific headsets. Um, Price range for the same varies from about 16,000, goes up to a few lakhs. There could be monthly subscriptions for the same as well. Um, Main psychiatric uses, as discussed before, comprehensive therapy for anxiety, OCD, phobia, autism, ADHD, stress disorder, substance use, dementia, neuro rehab, etc. We can see that there is so much that is coming into India, and people here are also adapting to the newer technologies. The hardware use. Some of the popular headsets that are used are MetaQuest 2 or 3, as shown in the image. The first one is MetaQuest 2, second one is MetaQuest 3. Other ones include HTC, Vive, Pico VR, and compatible Android-based VR devices. You can connect these to major setups or even uh, app-based equipment. You can download apps and you buy these headsets and use them for therapy. VR applications in psychiatric disorders. Anxiety disorder. Multiple meta-analyses show that virtual reality exposure equals or surpasses the traditional exposure. There is high treatment retention. Virtual reality headsets contribute to facilitating clinical gestures, examinations, and to bring a sense of well-being in anxiety-provoking situations. Among the many applications, they can be used to simplify PRP injections, perform an IVF puncture, manage the stress of a local anesthetic, support the anxiety of palliative care patients, calming children in hospitals, facilitating interventional radiology operations like biopsy, drainage, etc., elevating fear before a clinical examination such as colonoscopy. As you can see in the image on the top left-hand side, a simple procedure is being performed. And here, because they are using a VR headset to calm the anxiety of the patient, they can do it under local anesthesia rather than using or putting the patient through general anesthesia. Applications of this are immense. Phobias, one of the most widely used categories of psychiatric diseases where VR is being tested. Virtual reality for fear of flying, heights, spiders results in enduring reduction in symptoms. Strong patient preference for virtual reality therapy. A self-training program with mobile VR individuals with acrophobia has safely been used and successfully applied to reduce fear of heights. Now, what is different here is one, you will take the patient to a very high building and then put them there. It is very anxiety provoking. Versus in the virtual reality, you have the safety of being on ground and also experiencing or facing his fears through the virtual reality headsets. And also, you can gradually increase the stimulation, you can gradually increase the height, which calms the patient and provides a better and more enduring reduction in symptoms. This is why it is being preferred for most of the patients with phobia. Recently, VR with repetitive transcranial magnetic stimulation, RTMS, over the prefrontal cortex had been applied in participants with spider phobia. It diminished the activation in the left inferior frontal gyrus in functional near infrared spectroscopy. However, the results were not superior to conventional therapy, so it was dropped out. Other such trials were Behave VR and Oxford VR. PTSD, another place where the West is putting in a lot of money into VR, is the PTSD, post traumatic stress disorders, simulation for the recovery, veterans, trauma survivors, safe re-experiencing of scenarios, customized for individual needs. In 2014, a virtual reality application used as a prolonged exposure therapy tool for military-related trauma called Brave Mind was reported. Brave Mind is an acronym for Battlefield Research Accelerating Virtual Environments for Military Individuals Neurodisorders. As you can see in the picture below, this is how the simulation setup is if you want to imagine something like what would be happening. So this is how it is. There are a lot of feedback wires attached to the patient and a gaming control where she can control the stimulation as well as a headset. And on the above photograph, you can see what she will be perceiving as the audio, visual, and haptic. Coming to social anxiety and public speaking, gradual increase in the audience and social demands can be done via VR, which is slightly not possible through conventional therapy, proven to help social anxiety and performance phobias. Panic disorder and agoraphobia. Create subways, elevators, or crowds. Practice exposure in VR while with real-time physiological monitoring. Of course, the biofeedback is always monitored when a patient is undergoing VR, which is also a big plus point because you can see how there is physiological improvement as well as psychological improvement in the patient. Gender dysphoria, a very interesting topic, a very interesting disorder where VR is being used. Virtual sex reassignment therapy. Through use of available virtual reality video games and chat rooms, those with gender dysphoria can create avatars of themselves, interact anonymously, and work towards therapeutic goals. So an individual who has gender dysphoria can, rather than going through sex reassignment surgeries, sex changing therapies, can first experience the same via virtual reality. They can change their clothes, their outer appearance, their phenotypes, and see what they like. See if they want a permanent solution for the same. This also is helpful for the patients who cannot afford such expensive therapies, such expensive surgeries. This allows them a, a time and space where they can be themselves, the ones that they are more comfortable with. OCD and generalized anxiety. There is currently limited protocols for the same, but the research is expanding for contamination, checking OCD, and for VR relaxation and generalized anxiety disorder. So we have a company in the United States, Virtually Better, which was founded in 1996. They collaborated with academic groups in early virtual reality therapy research for specific phobias and related anxiety disorders. Many controlled trials by Rothbaum and colleagues in the late 1990s and early 200s found that virtual reality exposure therapy is comparable to in vivo exposure for fear of flying, with maintenance at follow-ups. These studies helped establish virtual reality exposure therapy as a clinically investigated modality. Another very interesting application of VR is in the patients with schizophrenia and psychosis. VR helps manage paranoia and hallucinations, avatar therapy, and stimulate activities of daily living. Patients with schizophrenia show anhedonia, social withdrawal, and a blunt affect, which can lead to rumination and isolation. So, an interactive virtual reality therapy has shown benefits in social skills such as role playing, memory function, medication management skills, job interviews, and vocational training. We see that with all of these therapies, the patient becomes more holistic and the socio-occupational functioning of the patient improves. There are also another way that VR is helping patients with schizophrenia confront their hallucinations. Of course, it is in a very trial phase, but there are researches going into how a patient can talk back to their hallucinations, their auditory hallucinations and their visual hallucination, which helps them confront what they are hearing or seeing in a more simulated environment, more controlled environment. This helps reduce the anxiety associated with the auditory hallucinations, and they learn to live with it better, cope with it better. But of course, the protocols and the VR are still under trial phases. Autism and child psychiatry. Another major area where VR is being used. VR classrooms and social scenarios boost engagement, functional skills in everyday life, and generalizational skills for ADHD and ASD patients. Florio developed VR lesions for autistic individuals to practice joint attention and social communication skills. The developed game provided to be potentially useful in the context of emerging immersive virtual reality technologies, of which use in therapies and serious game is still in the infancy phase. Our findings suggest that serious games using these technologies can be used effectively in helping people with ASD become more independent in outdoor activities, specifically regarding the use of buses for transportation. The University of Texas has developed a training program to assist in social training of autistic children. It uses brain imaging and EEG monitoring. After completion of the program, the activity of the brain area associated with social understanding was found to be increased in participants' brain image. Smith and colleagues at the Northwestern University Psychiatry Department have reported that young adults diagnosed with autism spectrum have a higher job search rate than the comparative group of 6 months after receiving job interviews through VR. So you can see how the socio-occupational functioning of autistic individuals is drastically improved on taking VR therapy. They are able to, say, use public transport, like take the bus. They are able to apply for jobs. They have the confidence to interact. It's a immensely useful emerging tool for such people. Addiction, cue exposure. VR replicates triggers for craving, helps the participants refuse and increase the coping strategies in a safe simulation. Now, if an addict goes out The major reason for relapse rate is craving and easy availability. VR helps to reduce the intensity or helps to cope with such situations because the markets are not going anywhere. The liquor shops are not going anywhere. The patients know where to get their liquor, they know where to get their substances. So, putting them in an environment which is controlled and safe, where they can't actually buy the substance or actually use the substance, but they get a sense of how to say no and how to cope when they're put in such a situation in the real world. Eating disorders or body image issues. VR mirrors help reshape body perception and modify binge or purge pattern, aiding long-term recovery. Now you can see in the small image that is given below, VR is helping the individual eat with his friends and show him how eating can be enjoyable. There are also avatar VRs where bodies are reshaped. The patient can see himself as a little bit changed if they eat, if they take care of their well-being. So it helps with such disorders as well. Depressive and mood disorders. Early results. VRCBT is as effective as traditional therapy for depressive symptoms and suicide prevention. SPARX is a potential alternative to usual care for adolescents presenting with depressive symptoms in primary care settings and could be used to address some of the unmet demands for treatment. Before coming to this, I just want to mention how in 2006 there were NICE guidelines were introduced wherein VR was used for mild and moderate depression. Till about 2018, the NICE guidelines had VR as a part of treatment for depression. However, due to lack of structure and lack of how to train the doctors, the guidelines were revoked. So you can see how VR has been around for a long while because 2006 is like 20 years ago and it is still emerging and we are still trying to find its place in the medical care setup. Next, we have cognitive rehabilitation, an excellent place where VR is being studied for stroke, brain injury, VR for attention training, memory, and problem solving in ecologically valid tasks. Mindfulness relaxation applications. VR beaches and meditative environments lower stress and teach relaxation skills. People with insomnia can use VR headsets, which would take them to a relaxing environment and relieve their stress. Or people with generalized anxiety also use such techniques. VR and cognitive behavioral therapy blends VR immersion with cognitive behavioral therapy structure, enhances exposure, role play, and skill practice. Of course, cognitive behavioral therapy has become a gold standard non-pharmacological uh, treatment for management of major neurotic diseases in psychiatry. And combining it or blending it with VR immersion can have immense potential. Now, coming to the advantages of VR. One is transportation and proximity. There are many individuals who require therapy, but due to some form of immobilization like paralysis, extreme obesity, they are not able to go to the doctors. They are not able to go to um, places where they can get the kind of stimulation for their fears and phobias. So VR can be done at home, can be done in centers in remote areas as well. So this is a major advantage for virtual reality. Then virtual rehabilitation can be performed in patients' homes and monitored from a distance, becoming telerehabilitation. Another excellent advantage where a person sitting in a remote area can also benefit from therapy. Patients' motivation. With simple things like high scores, in-game awards, and ranks, not only are the patients more motivated to do their daily therapy, they also have fun doing it. They forget that they're undergoing therapy. It feels like a video game to them. Objective outcomes measured for therapy efficacy. Limb velocity, range of motion, error rates, game scores. These are all measures that would not be possible via conventional therapy. Next we have the advantage of the patient feeling more actively involved in their desensitization. The next point of advantage is that the patient may forget that they are even taking treatment or are being observed, resulting in a more authentic expression. This is effective for hospitals to reduce their cost because of lower costs of medicines and equipment required. But this is also a disadvantage. Real world impacts. Patients' stories, engaged, more motivated, lasting skills transferred to real life outside of the clinic. Doctor patient relationships and careful education before using VR are mandatory before applying VR treatment in psychiatric patients. Now, challenges and limitations. Despite all of the merits that we have discussed today, VR therapy, as listed in the section above, there are pitfalls and obstacles in the development of widespread VR solutions. Cost effectiveness. Since the technology is very new, the cost associated with procuring the headsets, the software, is a little high currently. Treatment effectiveness. Since it is very new, we do not know the long-term effectiveness of the treatment. Migrating back to reality from the virtual reality becomes a tough job for the patient, specifically with, say, gender dysphoria. They do not want to leave the world that they are more comfortable in. Ethical and legal considerations. Now, again, since it's very new, there is no legal guidelines for the same. There are no ethical guidelines for the same. The acceptance by the medical community. The doctors do not have experience with VR, so they do not know how they can incorporate it better. So it is a learning curve for all of us here. Thus, the need for protocols and standardizations. The ethical concern is how clinicians should receive certifications for VR therapy. Now, the risks and side effects. With any therapy, there comes the downside, which is the risks. So, we have simulation sickness, over immersion, possible exacerbation in some cases. So, attention to patient safety remains very critical. Dry eye due to overheating of the head mount display, retinal damage due to blue light, addiction to VR environments, as we discussed in the previous slide, perceptual motor disturbances, and flashbacks. These are some of the very major and potent risk and side effects that we are currently facing in the research phase of virtual reality. Future directions. AI-driven avatars, improved haptics, which is improved sense of touch, expanded home usage. Patient doesn't have to come to the hospitals. Integration into primary care, using it as an adjunct to conventional therapy, and telepsychiatry. Conclusion. VR offers revolutionary approaches for the therapeutic and diagnostic landscape in psychiatry. Ongoing research and innovation will drive broader and safer adaptations of virtual reality. These are my references. Thank you.